What qualifications do older men look for in a doctor? Small fingers. Get ready to laugh because today we are breaking down and reacting to some of the most brain-rotting medical memes out there. All right, let's dive right in. Victoria's ancient secret. No, our ribs don't look like that. We all have very similar ribs. They're not busty like that. The soft tissue of our chest makes the extra bumps there. It's not the rib cage. There are individuals out there that have different rib cage abnormalities like pectus excavatum. So Victoria's Secret, we know the brand. It's been around since the 70s or something like that. It's a lingerie brand, so trying to play on ancient because it's ribs and a skeleton. I get it. Mosquitoes when they suck the blood of kids who eat lunchly. Okay. Lunchly is, I think, the new product by Mr. Beast. It's not that healthy for you, actually. It's processed. It's got a lot of sugar. Will it cause you a heart attack? I don't know. Probably unlikely, but I would not advise eating it. I would advise eating healthier options, healthy foods, minimally processed foods. Must be somebody who didn't like lunchly. What qualifications do older men look for in a doctor? Small fingers. So I don't understand the meme, but the small fingers basically means when you get older, there's the adage that you need to do a digital rectal exam, a DRE, and that's when you stick a finger inside the butthole to try to feel the prostate and see if there's any lumps or fogginess or enlargement. Typically, you don't have to start out that way. You can start with doing PSA checks and normal exams of a patient. But yes, there are times when you still need to do a DRE. Me after my doctor prescribes antidepressants, but from now on, you'll be taking medication. Do I smoke it or snort it or what? We don't give medications for people to typically smoke or snort. Doctors prescribe medications for ingestion. There are some that are injectable and there are some that you do inhale, but the inhaled medications are usually for the lungs themselves. And then injectables, very rare that would happen, but there are some. When I win the lottery, I won't say anything, but there will be some. Typically when people win the lottery, right, they may want to use the extra money to support any cosmetic changes that they would like, or actually take care of their own health in general, which would be great. Or you typically end up buying very extravagant things. Cosmetic surgery typically is out of pocket unless there's some reason for reconstruction that the insurance company will cover here in the United States. How it feels when your balls are full of pee, they start to hurt. No, the balls are not filled with pee. It's filled with sperm and the mechanics of making sperm, not filled with pee. Your pee is in your bladder. Kidneys, ureters, bladder, urethra, out. That is the same of male and female. If they hurt that bad, there could be orchitis, it could be epididymitis. There are a lot of things that can go on down there, so definitely get it checked out. When the doctor says you need to watch your drinking, meaning if you're drinking in excess, it increases the risk of having a lot of bad things happen to your body. There is actually no medical benefit to drinking alcohol. Drinking fluids, yes, very important, but alcohol in and of itself causes damage and hurts your liver and then can lead to a lot of other metabolic derangements within the body itself. And it also disturbs sleep and can mess with cortisol, so just be aware of this. What's the difference between an oral and rectal thermometer? The taste, that is so messed up. These are some different thermometers. We don't use these at the hospital, but we do have the ones that are electronic. And I will say they are color coordinated, so that way you do not accidentally use the rectal thermometer for an oral temperature. And the rectal temperature is better. It is a more accurate core temperature versus an oral temperature. Me trying to solve other people's problems knowing I'm totally unqualified. So messed up. Gotta be another reason to this. Maybe there's phantom limb syndrome and giving a visual cue. But hey, I draw sometimes at the hospital and I'm not an artist, but I will try to do depictions to help individuals, but I would not draw on them. The only time we end up drawing on the patient at the hospital is to mark the boundaries of, like, say, cellulitis or an infection, so we know if it's getting worse or better. Now, this is a story all about how life got twisted upside down. Oh, yes. So this is good. This is great. These are maneuvers that you do to help get babies out of a breech position. The natural and the easiest way for the body to come out is the head first, and it just has to do with the less likely that things are going to get stuck or not progressed. Typically, the time when somebody is in the head down position coming out first, sometimes you can have something called shoulder dystocia, where the shoulder gets stuck on the pubic bone of the mother. Again, there are other techniques to prevent that from happening. I'm going to have to draw blood. Thanks for waiting. So cheesy. We'd say that all the time in the emergency department, that we're going to get an EKG, get a chest x-ray, CT, and then yes, we're going to draw blood. But we never actually draw blood. We're going to take blood from you. Sometimes I joke and say we're not going to borrow any blood from you because we're not going to give it back, but we'll give you the results back. Me. Give it to me straight, doc. Doc. You? No. Wait. Give it to me gay. Doctor snaps his finger. Girl, bye, you're dying. Okay. Yeah. No. I mean, I will say that depending on the rapport that I have with the patient, there are times when you give the news very seriously and without joking, versus there are times when you can be a little bit more lighthearted because you are a human being, and maybe it's easier for the individual to also receive that information if it's a little bit more lighthearted. So hear me out. So working out makes your muscles big and strong. So a genital is a muscle, so wouldn't stroking it make it grow? So it is flesh and tissue. It is not a muscle. There are muscle attachments to it, but the corpus cavernosum and corpus spongiosum are specialized tissue that get larger when you have increased blood flow, but not from working it out. We don't do Elf on the Shelf at our house. I do Troll in the Hole. Kind of funny, but really messed up because I actually see this and these things do happen. I have not seen a troll in the hole, but I've seen many abnormalities relating to x-rays with things up the butthole that we have to get out. Kid, will you visit me when I get out? Nurse, LOL, nah, I hate graveyards. We're very positive individuals at the hospital majority of the time, and especially in scenarios where it could be life and death, you never say these sorts of things. I do manage and see patients that are close to the end, and we do everything we can to cheer them up and make them happy, but it's also trying to make them as comfortable as possible. Sorry, Sarah, I can't treat you today. I'm a family doctor and you're an orphan. That is so wrong. These things are mean. Family medicine just means that he would be treating this individual, that you do pediatrics, adults, and geriatric. You do the whole family. Blood cell, crypt cell. That's a red blood cell that's chilling right there. But that red blood cell is good. That is a normal shape, empty middle, like donut looking. They do come in different shapes and sizes, but in general, they should look like that. And if there's too many abnormalities in the sizes, then it could be a medical issue. So my husband just asked me, what's the difference between a left and a right tampon? Oh my gosh. It means light versus regular versus an S is super flow. So it has to do with how much volume of blood is coming out. So maybe for people who don't know, Tampax is a brand of tampon that women use during their menstrual periods to place within the vagina to absorb blood so it's not dripping out. Okay, well, I will say the memes today for this video were messed up in general, but very funny. I got most of them. They didn't go over my head this time like most of them do. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.